Welcome along to another episode of Irreverent Faith and Current Affairs. This is a podcast extra, and today we're going to be speaking about the topic of care homes and COVID. I am the Reverend Dr Jamie Franklin. It's good to be with you once again. And today I'm joined by two very special guests, Dr Ali Haggett and the Reverend Dr William Philip. Dr Ali is a former academic and historian, and now she works in the community sector, primarily in the area of caregiving to older men. So it's good to have you with us, Ali. I wonder if you could tell us something about your academic background, how it relates to the present subject, and what you're doing currently.
Yes, thanks, Jamie, and thank you very much for inviting me on here today. So my history really is working in academia. I was a lecturer for 10 years, working on the history of mental illness, mainly since the war, from the mid-20th century, looking at gender, men's mental illness and women's mental illness. I actually made a move about 3 years ago now to work in the community. I currently work in the third sector, in a community setting, working with older men who, for one reason or another, through medical challenges or through life changes, find themselves isolated and needing more social interaction. So I've been working on that sort of project for about 3 years, and I'm also a trained reminiscence therapist. So older people have always been really an interest to me. And I have a personal interest as well, because my own mum actually died in a care home not long before COVID. So a lot of the issues that are going to come up in this talk actually came across myself not so long ago. So.
Yeah. And can you say a couple of words about what reminiscence therapy is? I'm sure people would be very interested in that.
Yes, reminiscence therapy can be used in many different settings. It's often used in care homes, but you can use it in a community setting on a one-to-one basis as well. It's using memory really to foster well-being and positive thoughts. It's particularly useful in dementia, but it doesn't have to be exclusively used in dementia. In fact, in my community setting, I don't use it with dementia. We use it just to foster memories of well-being. So it's a very flexible modality and can be used in all sorts of different ways.
Brilliant. Well, thank you for joining us today, Ali. We're really interested to hear what you have to say. My other guest is the Reverend Dr William Philip, returning to the podcast. William's been with us before, but just to remind you who he is, he's the senior minister at the Tron Church in Glasgow, and he is a former cardiologist. I think you were a practicing doctor for about 10 years, weren't you, William? Something like that. So William straddles the ecclesial world, if you like, and the medical world in quite an interesting way, a fairly unique way. And that, I think, William has given you quite a unique ability to engage with the issues around COVID, would you say?
I don't know about unique, but certainly both my sort of disciplines in the background and in the present have given me plenty of exposure to, I guess, a wide range of the issues that surrounding COVID and how it's impacted people. So yeah, as you will have seen in church settings, I think people in pastoral ministry, because we have a sort of mini sample of the population, if you like, within our close contact, within our care and responsibility, it gives us quite an interesting insight into how things are happening in the general community. Yeah.
Yeah, absolutely. Well, it's great to have you back on, William. We're looking forward to hearing your insights. Right, let's begin. So we're talking today about care homes and the way that the COVID crisis has affected care homes, the residents, the staff, and the families and friends of residents. And so what I thought would be good to do to begin with is just to try and establish a framework for people. I think people listening to this, many people will have some idea of what's happened. It has been covered in the press to some degree. I know for me that the main way that I've really heard about this story is actually through listening to Alison Pearson on the Planet Normal podcast. I'm sure many people will have done that. She's covered this story to quite a significant extent, and her voice has been very powerful and prophetic. But nevertheless, I'm sure there'll be many people who have a fragmentary knowledge really of what's happened with regard to care homes over the past 18 months. So I wonder, Ali, coming round to you, if you could just if you could just tell us something about the story, starting in March 2020. You said you've had a personal interest in this due to your own personal experience, your academic background, and so on. So tell us what happened, what began to happen in March 2020, and what were the kind of salient points in this story?
Yes, certainly. Well, I can start with a bit of a timeline. I think we can all remember Boris Johnson's speech on March the 23rd. I think probably before that, actually, most care institutions had started limiting visiting, quite wisely. I think, going back to the first lockdown, we can have some sympathy to thinking about the precautions one needed to take for people coming in and out of these kinds of, care homes and hospitals. So I certainly have sympathy with what was happening then. But care homes went into complete lockdown, more or less, although I would say there are some examples of independent carers who, after the first lockdown, have managed to continue wonderfully and set a fantastic example. So I would just like to say that as well, because this can be a very depressing subject, and I would like to point out to the good practice. Yeah. But after the first lockdown, when I think the rest of us, I think it was first week of July, we all had some lifting of restrictions last year. But most care homes, I think, felt there was still a huge risk in terms of infection control. And broadly, I think many care homes didn't allow any visiting, through that summer. Even some institutions were allowing garden visits and these sort of pod visits and visits that were separated by glass. But in fact, some homes were actually not allowing people in still, even at that point. Yeah. So for me personally, around sort of end of last summer, I'd started noticing people posting on social media that they were not able to access their relatives. And I thought, goodness me, this really is awful, because that's a long time now, having after the first lockdown. It wasn't really until the beginning of 2021 that any attention was paid to this by Parliament or by any of the discussions and the briefings. Despite the fact that I think families were, campaigning pretty hard to Parliament and to their MPs. And in February of this year, Harriet Harman, actually from the Joint Committee on Human Rights, did write to Parliament and say that we need some sort of enshrinement in law to make sure that people can visit their loved ones in care homes. I think what was happening at this point really was that the government guidelines were just that. They were guidelines and not law. So what you have is individual care managers making their own interpretation of the guidelines. And if they felt that infection control was the most important thing, they were using that as a reason to stop people coming in. Yeah. And so by March 2021, the guidance changed a little bit. The government actually said that people should be allowed 5 named visitors, come what may. And also that one person could be nominated as what was known as the essential caregiver for residents who had specific needs, where family members could be particularly useful in perhaps feeding or encouraging medication and that sort of thing. And again, in May, guidance changed to say that actually residents should be allowed outside care homes to visits to other family homes and so on. But, again, what's happened is it's guidelines. So various care home managers have decided that that's not appropriate, and people are having huge difficulty still accessing their relatives or visiting their relatives' room. Sometimes they're still having garden visits and so on. So we're in a situation now, where are we, nearly in October, where these relatives are still having the same battles. And I know I've sent you some of the stories from the relatives I've been dealing with, and that you can tell how heartbreaking they are. And to be at this point, 18 months later in this situation, it's really quite distressing, I think.
Yeah. So I think it would be fair to say, Ali, that there is a significant concern about how the residents of care homes have been treated over the last 18 months. Now, it's important to highlight what you said, which is that there have been some care home situations which have been handled this difficult situation around COVID very well, but nevertheless, there's been a lot of neglect, and in some cases bordering on abuse of care home patients. And I'd like to dig into that a little bit more. So before we hear about the stories of people who have been separated from loved ones, there is one question that I'd like to ask, which is about the story about the exposure of elderly patients to infection, because as I understand it, at the beginning of the crisis, many elderly patients in hospitals were shipped into care homes in order to free up the beds, ostensibly because we believe that there would be this huge influx of COVID patients into hospitals. and that this was done in a way which exposed residents to infection with COVID. It was done in a very reckless and irresponsible manner. And I've heard it suggested that the reason that this happens was primarily a political one, as I'm sure everyone can remember very vividly at the beginning of this whole thing. The emphasis was very much on saving the NHS. Who could forget that? Unfortunately, the care homes were not protected by the brand of the NHS, and so it was politically expedient, let's say, to move the patients out of the hospitals and into those care homes, to free up those beds so that the NHS was not overwhelmed and the brand wasn't damaged. Ali, I'd just like to ask you, I mean, what do you make of that reading of the situation? And can you tell us anything more about the facts on the ground of what actually happened? Did that happen, and was it as bad as it appears to have been?
Yes, and I think actually even the government have admitted that happened now. And I guess to a certain point you can say, well, it was a time of crisis, and maybe you can say we didn't know what we were doing at that point, and we didn't know how many people were going to be admitted to hospital. But I wouldn't say that excuses what happened, because I think the most important thing was that these elderly people weren't tested. So, you know, where there was the ability to do testing, they were not tested, and then they were discharged into care homes. So the real infection control issue has been through that, and not through the relatives. So I think that's what they find even more heartbreaking about the situation, was that the excess death in care homes was almost entirely because of that, and not because of relatives coming in and out.
Yeah.
And there was huge excess death because of that. And of course it spread like wildfire.
Yeah. And can you say something else about the, in our correspondence before this, you talked about the blanket do not resuscitate orders that were given. I mean, I don't really know how this works, that were in place in care homes. Can you say a little bit more about that? How did that work, and how did it affect the residents?
Absolutely, and I think it happened in hospitals as well, for older people in hospitals, and actually to some disabled people. So I haven't got, I'm going by what the relatives have actually told me, but this did happen, you know, across the board. I mean, and without often family discussion. I mean, the key thing about that is it's supposed to be a conversation that's had both with the patient or the relative or the family. And this was happening, and people were discovering afterwards that these were put onto the patient's files and in care homes and in hospitals. Right. And I think there've been some studies by Age UK, I think, and I've read several studies where this has actually been documented now to have happened. So it's not just hearsay from relatives anymore. Which is a very distressing thing to find out. And I think some relatives have actually found it quite difficult to have those removed since as well. So
just to clarify, as there was a situation where care home residents had do not resuscitate orders put on their files when they hadn't authorized it, and their families hadn't authorized it. So in the event of what sort of a heart attack or something which would require resuscitation, the decision would be made not to resuscitate them and to let them die. And that this policy was pursued in quite an enthusiastic way. So that's what's happened. Why did that happen? Why were they putting these DNRs on these patients' files? Do you have any insight into that?
Well, that's a difficult question, isn't it? I mean, I think you have to ask perhaps Matt Hancock about that. I mean, I presume, I mean, some people would agree with having a DNR, but you know, being very elderly, wouldn't necessarily want to go through, you know, invasive treatment at that point. So there's nothing necessarily wrong with the concept of it. It was the fact that it was put on people's notes without them realizing. And I do know that obviously GPs were told that they couldn't actually help anybody that had other things than COVID. So an elderly person in a care home who was having medical problems of another kind were told that they wouldn't be able to be admitted to hospital and wouldn't be able to be treated either. So I really don't know why, other than the fact presumably they were very worried about the numbers of COVID patients that were going to be coming into hospital. And I guess there's that question about who do we treat? But the fact that nobody was told about this, I think, is absolutely
and what we were told was that a protective ring had been put around residents of care homes, which was well, it appears to be just the opposite of what happens. They were exposed to infectious patients, and that they weren't protected at all, and their quality of life, as we'll talk about in a moment, was significantly reduced because they were not allowed to have any visitors and were essentially imprisoned in their care homes, whilst at the same time being exposed to infections. So it's very opposite of a protective ring. William, can I just ask you, I mean, you're in Scotland. I don't know, was the situation roughly the same there? Is it different? Can you give us some insight?
I think broadly it's been the same. I think actually last year, I think the evidence is that there were probably more care home deaths, a higher proportion in Scotland even than in the rest of the country. But of course, all of these things are very politicized. I think one of the things that the whole COVID situation has stirred up and brought to light is that the devolved administrations have used this as a political thing, and so everybody's been trying to claim that they've done a better job than the other countries and so on. So there's a lot of hot air going around about all of that, but I think the truth is that it's been pretty much the same right across the country. Certainly, I would back up what Ali said there about in the very early stage. I know, because I heard from doctors in our congregation working in hospitals, that orders were given out that nobody over the age of 65 was going to be ever admitted into ITU. Now that was true at one stage, and that was, I think, reflective of the fact that they didn't know what was coming. They expected this virus to be sort of like other pandemics, indiscriminate and largely affecting younger people. I mean, let's not forget that normally speaking, a pandemic is something that kills young people. The 1918 flu killed people in their 20s to 40s. And in the beginning and in the fog of confusion and so on, you can understand that if people thought the hospitals were going to be absolutely overwhelmed with all sorts of young people, that very, very, very hard decisions were going to have to be made, and so that sort of thing was being said, that we're focusing on the under 65s. Now you can understand that and you can reason that, but I think the real issue is that it didn't take long. It took only a matter of weeks, really, before we understood that that wasn't the case, that this was something that in fact was hitting largely people in their mid-80s. Yeah. And people who are very vulnerable through some particular reasons of immunosuppression or comorbidities or whatever. So it didn't take very long at all for the picture to change, but none of the policies seem to change. Yeah. And I think we're still even today, 18 months later, dealing with things in many ways based on a presupposition about this illness that was made 18 months ago and is way out of date. And I think that's something that's that has been true in the care home sector, but it's been true in other areas as well.
Yeah, it's been true more widely as well. Yeah. Thank you for that. So just a couple of other things I just wanted to touch on, and then after that I'd like to hear some examples, some stories about people's experiences. But Ali, one of the things you raised in our correspondence was around the medical certification of the cause of death and the way those were handled in care homes. Now this is something which confuses me, because it seems that maybe you could tell us what exactly happens. But then also maybe your reading of the situation, because it seems from my understanding, it seems to be the case that the amount of people who actually died of COVID in care homes was probably overestimated, and it was because of the sort of quite, I don't know, careless or reckless way that deaths were being certified. So I mean, could you tell us something a little bit about that, and just what was going on there? Because I think for many people, I think there's a kind of strange contradiction there, because on the one hand, the government surely wanted to be seen to be handling the pandemic well, but then on the other hand, the way that these certificates were being filled out was very, very enthusiastically in favor of COVID deaths, when in fact there may have been little or no evidence at all that the person had actually died of COVID. So can you tell us a little bit about that, Ali?
Yes, certainly. And William might, as a medic, might have be able to throw more light on what's normally done as well. I know that obviously, again, in a similar fashion, I think not knowing what was coming our way. I mean, I understand that the government made some changes to the regulations to make that easier, because you might have doctors who are unable to go and sign certificates, doctors who might be ill themselves, and there were some genuine reasons why I think something under these circumstances changes must have been made. But it was on the 21st of April that the government actually published guidelines for doctors who were completing medical certificates of the cause of death, and said that, you know, in an emergency period, any doctor can complete the death certificate, because sometimes it's going to be impractical for others to do so. And obviously they might be isolating or unwell, or any of the things that I've just mentioned, really. So it became that any medical personnel could actually sign death certificates. And then in care homes, visits were really not happening. So a lot of the time it was happening over video call, or sometimes even on the telephone. And I have had accounts from relatives to say that actually nurse practitioners have been doing this as well. So you have a system where you haven't necessarily got the person that knows the patient in attendance signing the certificate. And whilst you can say you can understand why that rule was made, again, it does allow, I think, for quite worrying safeguarding issues if you can't be absolutely sure what somebody has died of. And the other thing that happened was really that the COVID-19 itself, from those regulations, was said to be an acceptable direct or underlying cause of death for the purposes of completing the form, even without the results of a positive test. So that's where you also get that the grey area, how we don't actually know whether somebody has died of COVID or not, because it was seen as acceptable for the doctor to put that on if they had a suspicion that it might be so. So there you have two issues where you have you know, quite significant grey area about, you know, what's actually going on the certificate and who's signing it. So we don't yet know, I think, the implications of that. I mean, because we can't yet see what look back and see what's happened. I don't know if William's got any thoughts on that as well.
I mean, I don't think there's any doubt at all that the numbers of deaths attributed to COVID-19 have been vastly inflated. In my personal experience, I know of people who have had that, who've died and who have had that put on their death certificate, who never had any signs or symptoms of COVID. Sometimes it's because they've been in hospital for weeks and weeks with all sorts of multiple problems, and because people were being tested every 4 days at one point, you know, by the time you're on your 7th COVID test, the chances of a positive test, even just from a false positive or from contamination, is very high. And but you know, when the underlying narrative is that everybody's head is being filled constantly with the assumption that, you know, anybody who dies, it's COVID until proven otherwise. That very quickly becomes, it's just COVID, and you don't bother proving otherwise. And you know, you can see how that's happened. So I don't think there's any doubt that it's been vastly overinflated. What's difficult to be sure about, in particularly in the early weeks and months in the care home situation, is there's just so much confusion, and you just don't know quite how much COVID is you know, has been significant. But the thing is that the average time, I think, that somebody spends in a care home is of the order of about 2 years. And I think, you know, people don't come out of care homes, you know, people go into care homes, and that's where they're going to die usually. And so over the course of 18 months, the vast majority of people who are in care homes from the beginning, you know, will die of something. And normally that will be some kind of, very, very commonly, it will be some kind of respiratory infection, some kind of pneumonia. That's you know, used to be called the old man's friend. I mean, that's people have to die of something. And if you don't die of a heart attack or a stroke, or of progressive cancer, nearly always dying of old age means dying of some sort of respiratory infection. And so even if it is an infection with SARS-CoV-2, that is the infection that is in the frame over this past 18 months, not influenza. And so even those who do die with a proven COVID infection, you know, it's not the same as that's an epidemic. You know, it's just that that's the predominant virus in the environment at that time. So even with that, the picture is muddied and made to look much more extreme than it is. But the problem is, deaths that are marked as COVID deaths, people have been made to feel some particular blame for. the government feel responsible for. You know, if you die of something else that nobody's ever heard of, or just boring, ordinary things, nobody's going to blame you. But people feel that they're in the firing line if somebody dies of COVID, and that has skewed things enormously and skewed people's behaviour and skewed people's priorities in a really very irrational way.
Yeah. And
again, you know, in the very early weeks, you can understand that, but you know, we've been beyond the very early weeks for 18 months now, and the rationality doesn't seem to have been restored. And I think that's the worrying thing, and that's where we have to start asking questions about, well, you know, why is that? Why have we gone off on this tack? It's very different from the way things have happened in the past, where there have been epidemics, and I think that raises a lot of questions.
Yeah, absolutely. And so, coming to what I think is probably the salient issue. I mean, the place where this sort of touches people is in the way that family and friends have been stopped from visiting care home residents. So as of March 2020, April 2020, the amount that people have been able to visit care homes has been reduced, either entirely during 100% during lockdown periods, or at least very drastically in subsequent periods, as you were describing, Ali. And just to say, Ali's shared with us a very good article which summarizes a lot of this, called "Protecting Them to Death," which I'll put on the show notes. But really, I want to talk about the human cost of this, the human cost of people being separated from their loved ones during, as William was saying, during those years, those final years of their lives, when they're particularly frail, with many people suffering from dementia and other challenges and difficulties associated with old age. Ali, I wonder if you could say a little bit about this and tell us about some of the examples, the human stories that you've come across with this regard.
Yeah, certainly. And I think the human angle in this is just so painful, particularly for people with dementia, because I think, as I wrote in my article, sensory impairment with dementia means that you can often not really hear properly, can't see properly, and obviously there's the confusion that comes with dementia. And of course, for many of those people, they didn't understand why their families were not coming to see them, so they felt completely abandoned and isolated in what's actually a very terrifying, very frightening disease. So I think there were two things going on here. There's the human angle and there's the safeguarding angle, because obviously people go to visit their relatives also to check that they're being fed properly and that they're hydrated and that they are in a clean and hygienic circumstances. I know that for me, when I had my mum in the care home, was just absolutely imperative. So relatives are talking about, apart from the isolation and the fear and the video calls, often trying to connect with people on Zoom calls when relatives don't understand who's on the end of the telephone. And there was a very heartbreaking one from a lady who I know very well now, Jane, who did actually get the story in the media in the end, of her mother actually breaking down when she heard her daughter's voice, because not understanding why she wasn't in the room with her.
Yeah.
All of these stories are absolutely awful, but then also realizing that people's hearing aids had broken and that nobody was able to go and repair them. So you had relatives that were essentially deaf for months, glasses being broken, people's ability to communicate in any way almost being removed from them.
Yeah.
I mean, the stories are just awful. And I mean, you can imagine for the first lockdown why you almost could say, well, I sort of understand why that's happening, but to be in this situation now and that's still going on, I mean, after sometimes 15, 16, 17 months of not being able to see their families, I mean, people dying alone. I mean, stories of tragic stories of people actually dying alone because the end of life, that might be something you want to touch on in a minute, the definition of what is end of life.
Yeah.
And of course, people not getting there in time, got married couples in the same care facility in different rooms or different parts of the building who died alone. Just the sort of thing that prior to COVID there would have been an absolute outcry about.
Yeah. And Ali, say something about the end of life definition, because that's very important.
Absolutely. I mean, I think prior to COVID, the NHS definition of that was broadly anybody who it was felt was in the last 12 months of life. And in terms of what that meant for access to your loved ones, it meant that you should have, absolute open access. And what we found is actually some GPs and care homes changing that definition to mean the last 48 hours of life.
Yeah.
Which is very, very difficult to predict. Often for elderly people in care homes, they can seem very poorly one day and then rally the next day and then suddenly decline and be gone.
Yeah.
And we have stories of people just not getting there in time or not even being allowed in at the end of life.
So the definition has changed from end of life meaning the last 12 months to the last 48 hours. So that is a significant change in the definition of what end of life means.
Indeed, and not officially. I mean, I think what seems to have happened is because there's so much confusion and the usual systems of safeguarding seem to have just been overridden. It's allowing this room for care home providers and GPs to change because of circumstances.
Yeah.
So I don't think they've officially been changed. It's just they've been interpreted that way through this crisis.
Yeah, yeah. And as you said, it's very, very difficult to predict what are the last 48 hours of people's lives, generally speaking.
And what it usually means is that in practice, it means once it's too late to have any communication because they've become unconscious. So by the time it's so obvious somebody is nearly at the very end, it's too late.
Yeah.
And in many cases, it's too late for them even to get there, before they die.
Yeah.
So really, that has been a really terrible thing. And one of the things that's talked about a lot to justify all kinds of things is, the effects of long COVID. Well, the effects of long grief are very devastating and very, very much greater than the effects of long COVID. People who have been through the trauma of this kind of thing with their closest loved ones at the end of their life will sometimes never, ever recover from that. It will blight their life. And it will blight their life in terms of their emotional, their psychological, but also their physical health in many cases for years to come. So it's not just about the tragedy of the person who's died on their own and the misery of that. It's about the effect that has had on their closest loved ones. And that's something we mustn't forget. And you will see that, and I see that, and anybody who's involved in caring for people, and that purely in terms of the sorts of things that governments are interested in, which seems to be numbers and costs and all of that sort of thing. The blessed NHS is going to be bearing the cost of that for a long, long, long time to come, especially in its mental health services.
Yeah, absolutely. I mean, as I say, I'm going to put this article up on the show notes, Protecting Them to Death by Ali, but it's a harrowing read, really. But I just think one of the issues about this is how widespread this is for people. So even in the comments of your blog, Ali, I'm just looking at them now. Somebody writing, it's 4:53 a.m. I'm reading this in tears because it describes exactly what has been happening to our family. I've been denied meaningful contact with my mum and dad since the start of all this. Dad doesn't know me now, and mum has died. She gave up because she had nothing left to live for following a stroke, which left her unable to contact anyone by phone or messenger. Thank you so much for telling our story. Another one here. Heartbreaking read, especially with both parents suffering from dementia, living through it. Family has been ripped apart by the separation and isolation from family. Suicidal feelings due to guilt are all too real. Standing outside closed windows in December with snow on the ground for 15 minutes, trying to shout to dad, diagnosed with COVID, and mum recovering from a hip operation after a fall. Couldn't get in to comfort either of them, both isolated in their rooms, not even allowed to see each other for months. Cruel and heartless. We need to get the laws changed to prevent this from ever happening again. An excellent commentary. My husband died in his care home on New Year's Day with no visits since the beginning of March. How many more words must be written before some positive, humane change? And it just goes on and on with people's lives being affected. I mean, one of the things reading through all these examples that I feel when I do so is just this the immorality of this situation. It is as though these people have been imprisoned. It's like they're in prison and their visiting privileges have been cut off. In many cases, I believe that the elderly were literally confined in their rooms and unable to even leave their rooms. Family members, husbands, wives, children, prevented from seeing their own parents, prevented from seeing their own spouses, you know, their closest relatives, people they've shared their whole lives with. Ali, I think you shared another story about a man and his wife who lived on different floors or in adjacent rooms, who couldn't see each other during this time, and one of them has been dying or has died, you know, so on and so forth. I mean, the level of inhumanity is absolutely shocking. And even if there were this horrendous pandemic, you would think that on some level the inhumaneness, the cruelty of this would have been addressed in some way. But we've really reduced these elderly people, that we've reduced their humanity, we've made them suffer terribly, we've made their families suffer terribly. And I just, you know, if I were to place myself in that situation, you know, say one of my parents or my wife was in a care home and I was prevented from seeing that person. I mean, how is this even possible, that this is legal? I'm sure many people are thinking that. I don't know if you've got any thoughts on that.
Well, absolutely. I think one of the points that Harriet Harman made in her human rights letter to the government is that this goes against human rights. Absolutely. Yeah. I don't know how it is possible. It just seems to me the Coronavirus Act has allowed some of these systems for people to override the systems that were there to stop this sort of thing happening. Right. And of course, the other thing is, you know, we're in a very different place now than we were in the first lockdown. You know, we were told that once the vaccines were rolled out, and we have a very good testing schedule now with people being able to do PCRs and also the lateral flow tests themselves. So we have relatives who are, you know, nearly all of them are vaccinated. They do the testing regime, and yet this is still happening. So there doesn't seem to be any excuse for it whatsoever now. Right.
So that's interesting, isn't it? This is actually, a lot of this is possible. So you've given me a list of stuff here to do with the Coronavirus Act. So the blanket do not resuscitate orders, removal of certificate 5 on the cremation form, the medical certificates of cause of death, the way that those have been filled out, and the way that the elderly have been cared for as they've been dying. You mentioned here the Liverpool care pathway being used when it has been formally replaced. You say these things have been possible because of the Coronavirus Act, but presumably they would not have been legal had it not been passed.
Indeed, I mean, as far as I'm aware, the Liverpool care pathway has been formally replaced because of the potential for abuses with it, and replaced by a set of 5 different priorities which should guide the end stages of life. I'm sure that probably William knows more about that than me, but I'm having, you know, lots of family members saying to me that their relatives have been taken into hospital from care home, and they're essentially being put on this end of life pathway, and it's being used as a reason to either allow visiting or not allow visiting.
Right.
So, you know, if the relative is on a pathway where that, you know, potentially food or hydration is withdrawn and there are no antibiotics being administered, then the relative is allowed in because that's actually, you know, really classed as the final days or hours of life. Yet if they're not on that, then the relative's not allowed in. Right. So it's being used as a way of kind of a bargaining tool. And I have evidence of this from, you know, written evidence from relatives saying to me this is happening, which for me is just outrageous.
So you're saying that they won't allow residents in unless it's an end of a life situation, and at that point food and water and antibiotics will have been withdrawn?
Yes, which was the whole point with the Liverpool care pathway, because that's the kind of thing that really, you know, there are big questions around that. Really, that shouldn't necessarily be happening. It should be much more of a flexible approach and an individual approach depending on what's actually wrong with the patient. So, but I've had accounts of this kind of pathway being used in a way that it really shouldn't be at the moment. I don't know. Again, William might have more of a medical take on that than me.
Not particularly, but I think what you say is right, and I think what the really alarming aspect of this is that you know, there are massively inherent dangers in pushing out of the equation all of those who actually will be the most rigorous advocates for the patient, for the person being cared for. And you know, what we've seen through this last 18 months of Coronavirus Act and so on is an extraordinary transfer of responsibility and authority from individuals and from families to the state and to institutions. And you know, the nursing homes in a sense are being given free rein to make use of what were emergency regulations. But, as we all know, there are very few things in life so permanent as a temporary government measure. But that's what's very alarming, because people have acquiesced into this. And I think for the bulk of people now kind of feel as though they're more or less getting back to life as normal, although actually it's far from normal. But there are large groups of people, and one of often the most vulnerable groups, like those in care homes and so on, who are just being forgotten about. But the changes to these procedures have been, I suspect, found to be rather convenient for many people. I mean, it must be much more convenient running a care home without having visitors coming in and out. It must be much easier to just do things in ways that cut costs and maximize profits. I mean, even if the majority of care homes are not doing that and are being responsible and ethical, I'm afraid not all will be. And that's why we've got these checks and balances. But it doesn't matter what laws you've got and what checks and balances there are in rules of the Care Quality Commission and all the rest of it. The fact of the matter is that the best check and balance on all of these things is people's relatives and those who love them. Yeah. And if they're excluded from the picture, that's a very dangerous precedent to have set, and to make it a privilege for you to be able to come and visit occasionally and when we tell you, as opposed to a rigorously protected right. That's a very, very dangerous place for us to be in.
Yeah, it's like so many things in this situation, things which we used to take for granted as our rights. Whether you saw that as some kind of inalienable right given to you by God, or something bestowed upon you by convention, or by some kind of governmental decree. These things have now been conceptually transformed into privileges that you're given, if you jump through certain hoops or whatever, if you comply with the system. It's a fundamentally different. The individual now has a fundamentally different role with regard to the state, and to my mind, it's one of the centrally most concerning aspects of this whole situation. And as you say, it's played out in a particularly disturbing way in care homes. I want to talk in a minute. I want to sort of talk about the issues from a psychological and spiritual perspective in a moment. But I think before we move on from the kind of discussion around facts and the narrative, I think it's really important to emphasize, isn't it, Ali, that this is still a massive problem for people. So in your article and some of the things you've sent me, you're talking about the way that in some cases care home visits are still restricted almost totally, and in many other cases they're restricted to a degree that is extreme in comparison to the way things were before. So things like people who are able to visit. So there's an example somewhere, I can't remember where it is, but of a child who I think had some kind of severe learning difficulties or something like that, and the parents were able to go and see him 6 hours a day, and now after a period of wrangling, they've been granted 6 hours a week in 3 2-hour slots. There have been other situations where care homes have been offering slots, 16 slots for a week for a care home with 50 residents, and these slots are 20 minutes long, and the visits are chaperoned, so they're hard to get. They're chaperoned. They're carried out in environments which are inappropriate, inhospitable, and so on and so forth. So I think it's worth just emphasizing that this is an ongoing problem, and that many people's rights to visit are still being hugely restricted. That's correct, isn't it, Ali?
Absolutely correct. And I think one of the things perhaps you put in the show notes is a link to the support groups, because what you'll see, yes, if you go on this ongoing situation, and I mean, the Rights for Residents have been working on this for a long time, but the people I'm actually working with are Unlocked Care Homes and their sister group, which is People's Care Watchdog. I can give you these for notes afterwards, but if you go onto these sites, you'll see that this is absolutely still happening.
Yeah.
And on a large scale, it's not a small problem.
Yeah, and it's being enabled to happen because the government have issued guidance as to how care homes might facilitate visits and so on, but ultimately it's up to the care homes how they run the show. And presumably, if you're a care home owner, as William said, there's an ease, there's a convenience to restricting visitors, but then also presumably there's it's an ongoing effect of the pervasive COVID fear mongering, isn't it? Because they're thinking, well, if we allow people into the care home, they might bring COVID in and all my residents could die, and then I'll be liable for that. So the easiest thing for me to do is simply to restrict visitors. But if the government were to make this some kind of legal obligation, presumably it would mean that the people who own the care homes were not liable in the same way. So really, there should be some kind of legislation involved here.
Indeed, and I think when I speak to the relatives, they do say that this is quite a complex. The cause of this is quite complex, and it is in some cases because of liability and the infection control issues just overriding everything else for fear of somebody catching COVID.
Yeah.
Also, a lot of them are in financial dire straits at the moment. The care sector was in a dreadful mess before COVID, and it's much worse now in terms of care homes needing to keep residents there for their financial security. But as you mentioned, and the relatives have said this often to me, that I completely agree, William, that it is easier in a lot of cases not to have relatives coming in and out, because there's no one asking where Auntie Mavis's dressing gown's gone, or this hasn't been done today, and can you do that? You can run on a pretty basic level just to look after the basic needs of people without any of the hassles that some of the relatives are going to bring, and picking you up on things. So I think there's a combination of all of those factors, really. And whilst some care home facilities are wonderful and they're run on such an ethical basis, and the people they're running it are there because it's their vocation and they love it, there are unfortunately bad practice, as you've mentioned, and in some places it's allowed people who don't want to do things properly to just do that and get away with it with nobody pulling them up on it. So it's a complex situation, I think, for us to unravel.
Yeah. Thank you, Ali. I mean, I'm sure that's going to be very helpful for people. And as I say, on the show notes, I'll put all of the links to those associations. So people who are struggling with this issue personally, or they want to support these groups, or indeed they've got friends or relatives who are having these problems, all those links will be there on the show notes. But I think that's good to establish a framework for what's going on. I'd like to talk now. I'd like to dig a little bit deeper into the kind of the societal issues that underlie this situation. And for me, this last 18 months has been a revelatory time. It's revealed things about the nature of our society, what we value, and what our values truly are, and so on. And I think this is a good example of something that's revelatory. Now, one of the things you mentioned to me before we recorded, Ali, was this from a secular perspective. Prior to COVID, what you've called the biopsychosocial person-centered model with regards to care. And I think what you're implying is that we've shifted from that sort of model, a kind of holistic model of treating the whole person with dignity and respect, to something which is perhaps, I don't know how you put it, but from my perspective, I see it as a kind of utilitarian anthropology, where people are thought of more as means rather than as ends in themselves. Could you say something about this biopsychosocial person-centered model for us, Ali?
Absolutely. I'm not sure we ever achieved it. I think it's more of a model than something we've actually ever managed to achieve. But yes, this idea that in order to look after somebody and foster their well-being, not just in death or in dying, but more broadly in terms of any kind of illness, and in my field of mental illness, is looking at the entire picture. So looking not just at the person, but looking at their environment and their family and their beliefs, their spiritual beliefs. So treating the person and the cause of illness also more widely, rather than just seeing an illness is caused by a certain function of the body, but actually looking at it more broadly in a more of a contextual framework. So I think that's the ideal rather than what we've actually managed to achieve. But I see it as it's gone completely out the window, frankly, with what's happening at the moment.
Yeah.
As we've demonstrated from our discussion already, I think.
Yeah, absolutely. I mean, it seems to be the complete opposite of that role of holistic care. Coming over to you, William. I wonder if you've got any scriptural or spiritual reflections on the way that we've treated the elderly and vulnerable with regards to care homes in this situation.
Yeah, well, I think what Ali said is helpful, because what's happened in this whole COVID situation is that we've become extraordinarily reductionist, and so everything has been about not just physical well-being, but physical well-being as related to just simply one particular illness and disease. And how have we been able to do that? Well, I think it's the culmination of a long march in our society away from a Christian understanding, a biblical understanding of what it means to be human. And I think often you said that this crisis has been revelatory. Often it does take a crisis to suddenly reveal something which has actually been happening for a long period of time. And I think that our understanding of humanity, our anthropology, has been slowly drifting, or perhaps in an accelerated way, away from what has been our common understanding in our Western culture for 2,000 years, certainly for many hundreds of years, into something that's just much more utilitarian. It's not an accident that healthcare and care for life is something that in the Western world grew out of Christianity. I mean, it was in the early centuries, in the 4th century, really, when the Roman Empire became Christianized. That was the time when everything changed. You know, life was cheap before that. Infanticide was common, exposure of children, abortion, leaving the sick to die, and so on. It was Christians who started the first orphanages, who campaigned against infanticide, who started hospitals. You know, right through the Western world's history, the monasteries provided not just education and so on, but hospices. Well, hospital, the word comes from the Latin word meaning hospitality, which was a Christian understanding. You know, right through to relatively modern times, our whole understanding of these things was something that grew out of Christianity. Now, the state took over these things relatively recently in our country's history, but it took over something that was built on a thoroughgoing understanding of the value of human life. And as that has changed and has been eroded by secularism, we shouldn't be surprised, I think, that a lot of confusion is the result, and eventually all sorts of results come from that, which are things that we actually begin to see are pretty grim. But we haven't understood where the rot has set in. I mean, the biblical understanding of human beings is that we are created, we are spiritual, we are relational, we are moral beings. That's very interesting that, in fact, lockdowns have diminished each of these things. Our responsibility has been taken away from us. We've been told what to do by diktats completely from the state. We've been herded around like animals, or shut up, cooped up. Our relational aspect has been massively curtailed in terms of the destruction of community, even in particular, as we've been seeing in the care homes, the prevention of that most intimate of community within family relationships, and of course our spiritual aspect has been greatly curtailed. Even church places of worship were closed. So morally, relationally, spiritually, lockdown has reversed all of that. And I think that is a very, very significant thing. Why could you do that? Well, only if you've become a society that is very confused about the most important things about human life. And I think that's at the root of what we've been seeing. There's a great confusion in our age. It's probably the great existential question, I think, of the 21st century. Is what does it mean to be human? People don't know. We're confused about where our identity is found.
Yeah.
our sexual identity, gender identity, all of these things, the whole identity politics that we're seeing, like a many-headed hydra popping up everywhere. It all comes down to this fundamental question of what does it really mean to be human beings? And I think we are very confused about that, and we've lost touch with reality, which comes from biblical foundations in our Judeo-Christian heritage in our society. I think that's where it all comes back to at the end of the day.
I was listening to something recently. I think it was James Orr, who's an academic at Cambridge, talking about the way that identity in the pre-modern world, it wasn't even something that people discussed. It just was a non-issue. Yeah. So there's no discussion of identity in an author like St. Augustine. It's just not there. It's a modern problem, this question of, who am I, where do I fit in? Because those kind of traditional and tribal structures would have just given people an identity. It would have been like a fish in water. It was something you don't even notice that you have an identity. But now we've got this enormous identity crisis. And you're quite right about the whole notion of identity politics. I mean, this is the salient political issue of our age now, and it's all structured around this notion of identity. Who am I? Where do I fit in? What rights should I have? What role should I occupy in the power structure of our age, and so on and so forth. I think for me, I mean, I totally agree with what you've said. In my academic work, I've done quite a lot on the transition from pre-modernity to modernity, and if you look at an author like Friedrich Nietzsche, for example, you read a book like The Antichrist. Nietzsche, I mean, one of my favorite Christian theologians, David Bentley Hart, says about Nietzsche that Nietzsche, unlike many of the critics of Christianity of early modernity, had the good sense to despise Christianity for what it actually was. Nietzsche understood that Christianity gave this immense weight of dignity to every single individual, not just the powerful, not just men, not just people who were physically strong, such as, in the Spartan culture, where they would, expose their weedy infants after they were born. If they didn't look strong enough, they would just expose them, leave them to die. Christianity bestowed human individuals with a unique dignity. And this was a unique and individual dignity. And this was innovative. This did not exist in the classical world. And Nietzsche saw this, and he despised Christianity for that reason. And he advocated a return to an aristocratic anthropology. So I think it's in the second chapter of the Antichrist, what is power? The power is the power to disregard the weak, the botched, the nothing. I mean, essentially the opposite of a Christian anthropology, which is all about care for those who are most vulnerable, care for those who are most voiceless, and the imperative which comes from the lips of Christ himself, I would say, which is to care for those who are the least among us. Those episodes in the Gospels where Christ would intentionally embrace those who were outcast in the society. I mean, prostitutes, tax collectors, sinners, but also children. He would embrace children in order to demonstrate this view of what a human being is. What's happened is as we've moved into a post-Christian society, we've increasingly struggled to make sense of what it means to be a human being, and for human beings to be valued as individuals. And I think what's one of the things that's being revealed is that we cannot find a way of conceiving each human being as an end in itself, in himself or herself, rather than as a means. And what I think is going on here with, for example, this situation in the care homes is that these people are not being thought of as human beings in that Christian sense. They're being thought of as some kind of problem. And I think a problem that needs to be solved, and it doesn't really matter what you do to them. And I think more broadly, it connects to the anthropology that has been implicitly foisted on us through this whole crisis, which is that basically we are to be thought of now as essentially bags of chemicals, which may or may not infect other bags of chemicals. And so the solution to that very, very narrow reductive anthropology, the solution to that is simply to separate everyone. So we're like it's, I mean, I don't mean this in a polemical way, but we're like kind of rats in a medical experiment. You know, we must be kept away from each other because because of the chemicals or the virus or whatever. So it's a very, very reductive anthropology, and I would tie it to that movement from a broadly speaking Christian societal worldview to a post-Christian societal worldview. And I think the challenge for the secular now is to try and find some kind of way of grounding the individual upon something. If it's not going to be Christianity, there has to be something else. Otherwise, we're going to move into a utilitarian society where, and in that society, the conversation will be about power, and it won't be, but it can't be about anything else. Because if it's not about love, I find it hard to see. I mean, I don't know what you make of that, William, but I find it hard to see what else it could be about than power. And in a society where it's just about power, of course, the powerless are going to be left to die, and separated off from everyone else. It can't be any other way. Is that the way you see it, William?
I think exactly. You've got the militant atheists like Richard Dawkins who will say, well, it's just about DNA. DNA neither knows nor cares, and we just dance to its music. There is nothing more. And the trouble with that is that it basically means, as you say, we're just bags of chemicals. There's no difference between humanity and animals and insects and anything else. And I mean, that's what we see driving driving much of the radical green movement today. And it sees humans as the problem for sure. And so the answer to the needs of the world are to depopulate the humans, to get rid of all the animals that are causing too much carbon dioxide, and to rewilding the planet. Well, that is, you only need to look at the biblical understanding of the purpose of creation, and you realize that is to reverse the purpose of creation. The biblical worldview says that God created all things, and that he created mankind as the crowning glory of that creation, under God, so to worship God, but over the rest of creation, to have responsibilities to steward it in the image of God. Now, we've de-godded God. But as C.S. Lewis said, when you de-god God, you unman man. And that's the problem. I always go back to Psalm 8, which is a wonderful psalm, a short psalm, which is reflecting on creation. And it asks the question in the middle of it, in verse 4, what is man that you're mindful of him? But it's in the context of beginning with, O Lord your God, how majestic is your name in all the earth. So it begins and ends with the majesty of God, talks about the glory of the heavens that you set out, and then asks the question, well, in the light of all of that creative glory, what is man that you're mindful of him, the Son of Man that you care for him? But it says, yet you have made him a little lower than the heavenly beings, crowned him with glory and honor, and you've given him dominion over all the works of your hands. You put all things under his feet, all the beasts and the sheep, the oxen, and so on. So that very neatly frames the whole biblical worldview, which is God made man. So man is not God. Man is lower than the heavenly beings, and yet God has crowned him with glory and honor above all creatures. So man is a creature. He's not God. But he's not just a beast like all the rest of the beasts. He's have to have dominion over them. Secularism has reversed that. It says, well, man is not a special creation in God's image. And that is why life can be cheap. That's the logical end of secularism. It's a utilitarianism. That's why we push for abortion, for euthanasia, for survival of the fittest, and so on. But not only is it just say, not only is man not in God's image, but there is no God. So not only is life cheap, but that means that really there is no such thing as ultimate good and evil. There is only rational utility. So, but it's terribly dangerous, isn't it? You remove God, so there's nothing above man. So that means that man is God. Yeah. But you remove a unique created nature of man, and you say, well, therefore man is just one of the beasts, one of, just a product of evolution, just like everything else. But where that leaves you is that you have a beast who is God. Yeah. Nothing more than a beast who has become God. Now, in his extreme states, that's what we've seen, isn't it, in the totalitarian regimes of the last century, in the 20th century, monstrous totalitarians, where there's no fear of God, the beast will rear its head. And that's I think, the tragedy of what we're seeing. If you take out a proper anthropology based on a creator above, to whom we are responsible, and a world around us which we are responsible for, then we've lost our identity, and we have to search around in all of these other things. But that's a very, very dangerous and damaging place for us to be.
Yeah, I mean, it strikes me that picture of the kind of, the sort of three-tiered universe, if you like. I mean, the Christian cosmologies come in all shapes and sizes throughout the ages, but that kind of three-tiered universe, which I think is a sort of fundamental part of it. You've got creation, you've got man, you've got God. Man occupies a kind of priestly position between God and the rest of creation. And so if you remove God from that situation, it's almost like man could move up or down, if you see what I mean. And in a sense, that priestly option is removed, because there's no longer a middle part. And so that's what I think you see in totalitarian societies. You see certain classes moving up, classes of men moving up to the status of gods, and everyone else moving down to the position of beasts. But you no longer have that unique anthropological position of standing above creation but below God. And there's and clearly the results are clear, aren't they, from history. And when you treat human beings as animals, it's very, very clear something of great dignity and value is being violated. And I think that is clearly what is going on here. I think human beings are being treated as though they're animals. And I'm pleased, William, that you mentioned the issue of euthanasia, and that leads to the question of a good death. Now, Ali, something that you shared with us is that you posit that perhaps secularization is leading to an increased fear of death and denial of death, and that this whole situation has exacerbated greatly that fear. And you posit that perhaps from a Christian perspective, although there's the belief in eternal life, there is surely still a moral dimension, the wish for / the right to a kind of dignified death and a quality of life in the months and days leading up to it. So I wonder if you could say more about that from your perspective.
Well, I was sort of rather hoping to hear from your perspective, actually, from the Christian perspective. But I know that from what I discuss with people, I know that people are, well, that we do have this fear of death, even in the vocabulary we use, don't we? We say we've passed away. We don't even like to use the term dying or death. And I know when my mum died, there were lots of euphemisms in the care home. One was she's turned her face to the wall, which I heard a number of times. Rather than coming to me saying, I think your mother now has given up, and this is probably the last stages. There were most of hushed discussions, and we don't deal with, in secular society, we don't deal with death very well, I don't think, and it's made it become this terribly fearful thing. But actually, I think what people are frightened of is the process of dying, and I feel that this has just made that so much worse. I mean, I've had discussions with my own family and said, whatever happens, none of us are going into care at the moment, because I find it utterly terrifying that one of you might be on your own dying, frightened, in pain. I've got evidence of relatives who say that their loved ones are not even having the correct pain relief at the moment, for a very complex set of reasons, but some of it actually neglect. So that does make it all, even if you're a Christian and believe in the idea of eternal life, that process therefore is then still very frightening, I think. I don't know if you'd agree with me, but I find it very frightening.
Yeah, absolutely. And I suppose, I mean, this whole situation is, generally speaking, quite negative and depressing. But perhaps one of the good things that might come out of this is us taking a renewed level of responsibility for those who are closest to us, rather than thinking, well, there's the option of a care home and so on and so forth, and moving back to a more traditional structure of care for one's family members across the generations. To my mind, that would be a good development, albeit coming from a tragic set of circumstances. William, is there anything you want to say in response to any of that? I'm particularly challenged by the idea of bringing the whole question of euthanasia, or assisted dying as it's called now, into this conversation. What do you want to say from a Christian perspective to all of this stuff?
Well, again, I think it's just a manifestation of the great confusion that reigns when our understanding of what it really means to be human beings made in the image of God and therefore precious in His sight is lost, because that we become so contradictory. On the one hand, I mean, we've got a bill being put forward at the moment in the Scottish Parliament, once again trying to promote euthanasia. So we're wanting to make it easier for people to die, whilst at the same time we're destroying people's life and meaning in life in order to protect them, so that they cannot die of COVID. So these are two totally contradictory things, as though the most important thing of all was merely the length of life, and therefore we can't possibly risk a relative coming into a care home to see you, to enrich your life, just in case it shortens it because of a virus, whilst at the same time we're also campaigning to shorten people's lives. I mean, these two things are absolute opposites, and it's a mark of confusion about what life is really all about. Now, Christians have always argued against euthanasia because we believe that is therefore usurping the place of God. We believe that God is sovereign over life and death. That doesn't mean that we must always strive to extend life as long as possible, because we understand life in a more rounded sense. It's not just merely physical breathing. So, no serious Christian ethicist is going to say we must extend life as long as it possibly can be extended, put everybody on, life support machines forever, that kind of thing. It doesn't mean that at all. It's taking the thing in the round, but there's all the difference in the world between recognizing our mortality and recognizing that there is a time to die and that time is coming, and usurping the place of God and saying, well, we therefore can control that. There's a humility that's involved in being human under God. So I think, I think it was was it Chesterton who was supposed to have said, when people stop believing in God, they don't believe in nothing, they believe in almost anything. When you stop, when you turn the truth into a lie, when you turn things upside down, you get confusion in every aspect. You get contradiction, and you get confusion. And I think that is a mark of our society, and that's why we can. When you lose real truth, when you lose the understanding of the image of God in human beings, you lose the understanding of what it means to care for humans as God cares for them. So I think I quoted to Ali the other day from verses from Psalm 68. Father of the fatherless and protector of widows is God in his holy habitation. God settles the solitary, the lonely in a home or in a family. He leads out the prisoners to prosperity. So that is what God is like. And therefore, for human beings to care for other human beings in a way that images God is to care for the most vulnerable, the fatherless, the widow, those who are solitary, those who are lonely. He sets them in a home. Now, if we find ourselves doing the opposite of that, exploiting the most vulnerable, not caring for the elderly, the widow, the orphan, not caring for the lonely and bringing them into a place of relationship and warmth and care, then I'm afraid what we have to realize is that we are displaying the image of the opposite of God, the anti-God. We are imaging the evil one, the devil. And that's a fearful thing. But it does seem as though there have been many images of that evil at work in our society today. And the care home is just one aspect of it. But when you see some of the measures, the draconian things that are being done in order to protect us, you have to ask yourself, is this is this playing out an image of the God of heaven or the devil of hell? And I'm sad to say that in many cases, it seems to be a great deal more of the latter than the former.
Yeah. And I think from the question over euthanasia is quite a complex. I think from a Christian perspective, it's quite a complex answer, as you've indicated there. I wrote an article a while ago on the subject of living death, and two of the images I used were Gollum in The Lord of the Rings and the figure of the reanimated corpse in zombie films, to illustrate the point that that life in itself, in just life, bare life, is not always worth having, because life can be a kind of living death if it is prolonged in a way which is unnatural or cruel. And where that line is it's not, we can't specify in a conversation like this. But I mean, in The Lord of the Rings, Gollum lives an unnaturally long time because of the power of the ring. And I think that that's something that that can potentially be concretized in certain forms of medical care, like putting somebody on a life support machine in a way which is not appropriate, and prolongs their life, prolongs their suffering in a way which is unnatural. But there's a huge difference. There's all the difference in the world between saying there are certain treatments which are not appropriate at this stage of life, and we have to accept this is the right time to die. There's a huge difference between that and saying this person's suffering, and therefore we should give them something that is going to end their suffering, something which is going to kill them. I would say that fundamentally changes the nature of the medical profession. I mean, you could argue that abortion does the same thing. I mean, I would argue that, but it turns the medical profession on its head, because it's no longer about giving care to people and making people feel better. It's about killing them. It's about harming them. So it changes that, but it also changes the nature of society as well, because society is no longer set up and geared towards caring for the most vulnerable. It's now introducing the question of, all right, who should be alive and whose life is no longer worth living? And that for me is a very, very dangerous question to be asking. It's the wrong question societally to be asking. It's the wrong question. And it transforms people conceptually from people who should be cared for no matter what, to people who might be better off dead. And actually, you know what? Society might be better off without them as well. So it's a very, very dangerous place. I don't know, Ali, do you have any further thoughts on that? Does that sort of make sense from your perspective, or how do you see it?
I would completely agree with you. And then going back to what William said earlier on about the aspects of lockdown, every single aspect of what was done to us during lockdown is removing all those important facets of being a human being. Yeah. And personally, I felt crushed by it. I mean, not being able to touch or physically have contact with all the things that make life, being a human, worthwhile. Were removed, and I found that so shocked. And what I was so shocked about was the way in which so many people just accepted that in the name of what we were being told. And if I could just pick up on one thing that I thought during a conversation a minute ago about it seems to me that medicine has almost replaced religion as a new religion, really. And I think that's quite an important theme that comes through. So I've seen this in my historical work as well, looking at medicine as it's developed since the 1950s. From antibiotics and so on, magic bullet sort of discourse, and I've seen that massively in the imagery around the world, with the discussions about the vaccines and corona replacement. I think like this week was saying that the vaccinated are apostles and they must. So it's as though science and medicine has become the new religion, and that leaves us with all the problems that we've just articulated so beautifully. I think really your conversation I found very, very useful.
Yeah.
Thomas Sydenham, who was regarded as the father of English medicine in the 17th century, had a series of he was a committed Christian, a series of principles. The first of which was that every doctor must remember that they will render an account to God, the supreme judge, for every patient in his care. And so, the history of the development of medicine has been within that framework. That there's a humility. We are caring for every individual human being because they are valuable. They're made in the image of God. They're not just a bundle of cells. there's a proper place there, and we do it under God, and and there is a moral framework, and there is judgment for that. But I think you're right. Since the 1950s, in particular, that has changed very much, and I mean, it's been extraordinary to see the deification, not just of medicine, but in this country, particularly of the NHS. I mean, if a Martian arrived on Earth and was going through our cities and trying to work out what religion this people had, from looking at people's windows, they would say, well, it's got something to do with a rainbow, and NHS must be the goddess. Yeah. People come out every week and they clap and cheer for the goddess, and then they're even willing to sacrifice themselves to save the goddess, because this goddess seems to be so lacking in power that, in fact, the entire population has to sacrifice itself and become ill and not seek treatment in order to save this goddess. I mean, it's absolutely extraordinary. In fact, it's blasphemous, and there've been extreme examples of that. I mean, was it the mayor or the governor of New York preaching, as you said this week, you are the apostles of this message, to go out and vaccinate people. Similarly, with the projection onto the statue of Christ in Rio de Janeiro of vaccines save. I mean, that is just, not only is it ludicrous, it's deeply blasphemous. So health and healthcare and institutions have been set up as the national gods that we're to worship, and if you don't, you're a heretic who will be hunted down and attacked and vilified. Yeah. It's assumed the proportions not of the true religious faith, but of the anti-true. It is an anti-Christian. It is a demonic thing. It's cultic, and the behavior control of the cult has been something that's been very evident in that. So I think you're right. It's a competing religion, but it's not just COVID. It has other tentacles. So I think, we will see in the next few weeks. I live in Glasgow. We've got the COP conference coming. Well, another branch of that religion is worship of the earth, worship of Gaia. And again, humans are expendable in that. Humans must be made to suffer so that the earth can be worshipped. These are all different manifestations of anti-truth, anti-God, anti-Christ religion. And the Bible tells us to expect that in these last days, that's what we will see manifest. And I think these are different manifestations of it that we've been living through. And I think perhaps people are beginning to wake up and see that. And when they see the ugliness of it, and in fact the darkness of it, they are then saying, well, where is the solution to this? Yeah, that's why I'm getting people emailing me and writing to me, as I know you are as well, Jamie, saying, what's the answer to this? Tell us about Christian truth. And it's very striking.
Yeah, it is. The other thing I wanted to say as well is just a reflection on the whole notion of touch, which is something that you spoke about in your piece, Ali, and the importance of physical touch and how that's been taken away. The importance of physical touch, for example, with people who have got dementia. And for many of the people who have dementia, again, this isn't something I know a huge amount about, but you talk about the way that actually touch can be the only thing that connects them to another human being, the only thing that really connects them to their identity, because they're losing so much. And so to have that touch taken away from them is to have almost everything that's valuable taken away from them. And the cruelty of doing that is immense. But it led me to reflect more deeply on the nature of touch more generally. And something I've noticed being a father with young children is that when my children hurt themselves in a particular place, if you touch them in that place, it makes it better. And there's something that's healing. There's something that's literally healing about being touched. I don't know, perhaps you two know better than me, but I'm sure there must be some kind of physical reason for this, that actually being touched makes the pain better. You know, there's something literally healing about physical touch. And so it's not only an emotional and psychological thing, but there's something actually physical about it as well, which is wrapped up in it. And so the whole notion of not touching one another, which has become so utterly pervasive, is profoundly unhealthy, I'd say. I mean, I don't know. I mean, is there any scientific basis to that, do you think, or what do you think?
I actually trained in something called kinesiology 3 years ago, which is it's an energy modality, and it's all about that kind of touch and how healing that can be. And a lot of the tools that we use actually in that, it's a wonderful modality, are very simple techniques, which we often find to rub your skin when you bumped yourself, you have a natural to rub that. Well, actually one of our techniques is actually that moves energy by actually using that action. And there are certain parts in the body that we automatically we do this when we say, oh my goodness, or we have acupressure points here which are naturally used. We just do that anyway. So that touch itself we have an instinctive I'm trying to think of the right word to use really now, but we use it naturally anyway. And so what you've noticed with your children is absolutely the case. And I mean, the fact that we're going to find that all much more difficult now, because you already see, even if we're happy that no one has COVID, the whole hugging thing has now become quite even more difficult than it was before. So I wonder where this takes us actually in that, because it wasn't terribly good beforehand, which is why I went into this sort of training actually to see how powerful that can be alongside traditional medical approaches.
Yeah, absolutely.
I think you're right, Jamie. I mean, it's well recognized that we are psychosomatic beings, and you just can't separate these things. And I think Christian theology in particular is helpful in that, because the biblical understanding of the person is utterly holistic. There's none of this sort of the Greek dualism that has crept in often into the separation of the body being evil and the mind being pure and so on. But that's just not a properly Christian and biblical concept. And we see it, of course, manifest most completely and perfectly in God incarnate, in the person of the Lord Jesus Christ. He healed people often with a word. Touch was not necessary for his healing power, but he touched people. He touched very often those who were untouchable. The lepers. I mean, that's very striking. Those who were considered by society to be those who had to be kept away in quarantine because of their contagion. These were the ones that Christ made particular purpose of touching. Just yesterday, actually, just to illustrate the importance of this, just yesterday I was speaking to somebody who had a very difficult life and background, had never known their father. And she described to me something that happened to her about 15 years ago, when a Christian minister she'd been talking to him, and he just put his arm around her, she said. He put his arm around me and said, "It's going to be all right." And she said, "Is that what it's like to have a father?" Now, she'd never known her father, and but she said, "I'll never forget my whole life him putting his arm around me and saying, 'It'll be all right.'" Now, there's something very profound in that, isn't it? That is touch. And you might think, well, I'm sure that person who put his arm around her never thought about it for a moment and has never thought about it since. But she's never forgotten it, will never forget it all her life. Human touch, the connection, there's something much more than just the physical. It transcends that, and it's that is just redolent of the fact that we are, as human beings, vastly more complex than we even understand, even with all the multidisciplinary sciences we have today. And the ultimate answer, the ultimate reason for all of that, is that we are beings made in the image of God himself, God the creator, God the relational one, who loves us, who cares for the fatherless, the widow, the one who hasn't known what that means. There's very, very great profundity in that. And modern biological reductionism is just so barren, so destructive of true humanity. We must turn back to the richness of a true Christian anthropology, and we will be great. Greatly the better for that in our society, and perhaps post-COVID we need to push that more than ever. I've never been a particularly sort of great hugger, but I have to say that since COVID I now hug as many people as I possibly can at every opportunity.
I have got one anecdote which really summarises that. Sadly, we lost quite a number of our community group over lockdown, not through COVID, but through issues related to lockdown, really. And of course, we weren't allowed to attend proper funerals. So on one occasion, a couple of us actually lined the pavement to one of our group and saw him off that way. And his widow rushed up and gave me this huge hug and burst into tears. And it was wonderful. It was absolutely wonderful. And I burst into tears too. And then very sadly, the next day I had an email from her saying that she'd got home horrified and apologized because she'd hugged me and she realized she really shouldn't have done. And I've kept that email because that for me just really describes everything that we've been through and how utterly outrageous that is, that in her moment of grief she went home feeling guilty that she'd hugged me. And obviously I replied and said it was wonderful and I'm so glad you did, but that's where we are, and how awful is that? It's
absolutely crazy when you consider the place we've come to, isn't it? I think that's a good note to end on, an encouragement to overcome your English or Scottish lack of what's that word to do with touching? I can't quite remember it. Tactileness, tactility, and to hug as many people as possible, shake as many hands as possible. I'm sure I'm not coming from a scientific perspective, but I suspect there's something deeply, deeply healthy about it, even from purely physical and medical perspective. I know one of the things I really enjoyed when I went, I've only been on one of the protest marches, but we're seeing so many people there, shaking so many people's hands and hugging people as and when it seemed appropriate. But it's a good note to finish on. And just to reiterate, I'll put all the links to the Rights for Residents, Unlock Care Homes, and anything else that Ali wants to share on the podcast notes, which can be found on the website reverend.buzzsprout.com, or they'll just be underneath the show in whichever app you listen to, whether it's Apple or something like that, and of course Ali's blog as well. And so I think what I'll do is I'll just say a quick prayer and then we'll finish off. So let's say a prayer. Dear Lord, we give you thanks for this conversation, for this time together, and we ask especially for your blessing to be upon everyone who is in a care home in the United Kingdom, for you to bless them, give them comfort and peace. We pray for the freedom for friends and families to be able to visit them, and for your comfort and peace to be with friends and families as well. We pray for your blessing to be upon everyone listening to this or watching it, particularly to be upon people who are affected, are suffering and in pain because of these issues. We offer all of these things to you in the name of our Lord Jesus Christ. Amen.
Amen.
Well, I just want to say, William, thank you so much for coming back on, and Ali, thank you for being on for the first time. I think what you've shared today is offered real insight for lots and lots of people, and it's been so helpful. So thank you so much to both of you.
Thank you.
Thank you. Thank you for having me.
Oh, it's been a pleasure. Thanks to all our listeners as well. Do join us for our first anniversary episode coming up next week, and we will see you then. Bye-bye.